my interests outside surgery do fall into the role of procurement, because I see that there are huge areas where we can make gains to the health service and improve the health economy. I think that we maybe are underfunded in the health service, but I think we could also make better use of the money that we have. Now that leads to another stream of work, which is Scan4Safety, which is looking at barcoding on products, because then we can do what the supermarkets have been doing for years and years and years, and they know exactly what I spend in the supermarket. They could probably fill my basket from my past month's buyings and purchases. They could fill my basket without me having to do any effort, and they know what I spend. Now why don't we know that? And the reason we don't do it is because the manufacturers have not been barcoding in a systematic manner, which is GS1 barcoding, and they haven't been barcoding because we couldn't read, and we couldn't read because they have not been barcoding. So now it's mandated from 2020 that everyone supplying into the NHS will have GS1 barcoding on, and various hospitals, and we're one of them, are leading on developing a very, very accurate system. We will know exactly what we're spending in terms of items in theatre, and we will know we should be scanning in the staff so that you can track people through the hospital. It's not a spying system, it's very useful because you can then track patients, so there's no point sending them to go have an MRI scan where they're down having the colonoscopy, because so you know where they are. And we can also tell how long things take on that basis then. So someone, if they're scanned through the doors from the anaesthetic room into the theatre, and then when they come out of theatre, we know exactly how long they've been in theatre. It gives us a way of tracking that we've got the correct patient, that we're going to do the correct procedure, because we can scan that off the operating list or the procedure list if it's the procedure outside theatre. We can scan that we make sure we're putting in the right implants, so that if I'm listed up to do a right total knee replacement and we're scanning in for a left knee replacement, that would go boop, boop, boop. And we can then also track on to competency, so that if I'm put down as a primary surgeon to do a gastrectomy, that should come up, whoa, Chris hasn't done a gastrectomy for 20 plus years. Is he the right person to be doing it? Or we target and we say that to remain your competency for knee replacement, you do 30 a year. So we're coming up to near the end of the year and I've only done 20. That needs to could flag up then saying either Chris gets another 10 in very quickly, or else he needs to have a senior assistant with him to make sure that he is correct. We can also do that for our trainees, and it will make maintaining their logs so much better and so much easier, and we'll be able to visualize what they've done in training.